But let us go to why we are all here. Our focus today is on the attachment-related family pathology known as parental alienation syndrome. The syndrome is defined as the psychological manipulation of a child by one parent in order to alienate the child from the other parent. And sadly and typically, this occurs often during and following a divorce. And I know you are sitting there thinking you've heard a story about somebody, or it happened to your sister and brother-in-law, or whatever it might be. But indeed, and our expert's going to tell us, it is indeed a real syndrome. There is a pathology to it. We need to understand it before we might even be able to begin to address it. And as I've said, the committee's fortunate then to have with us today Dr. Craig Childress, a psychologist from California, who is a renowned expert on parental alienation syndrome. Dr. Childress will brief the committee on this syndrome and its effects on children, which many consider to be tantamount to child abuse. Also severely affected, as you would expect, is the parent who's been alienated in this process and effectively erased from his or her children's lives. Doctor, we welcome you. We certainly appreciate your willingness to travel across the country. Some of us have trouble coming 2 hours, from to get to Harrisburg. So we appreciate what you have done, and because you know this is important, and we wish to be educated. So if you would please come up and sit there, and you will have the floor. We hope, ladies and gentlemen, there will be some time for members to ask questions and further discuss this very unpleasant, but it is a very important topic. And I think, sir, it's a topic we really don't quite understand. And indeed, some would say, oh, it's not that bad. So we look forward to this.
Thank you.
Yes, that is correct. My executive director reminded me, Doctor, we have some copies of your book.
Mm-hmm. Yes.
All right, that we would be happy to share with our members. All right, called Foundations.
Right.
And I assume you'll be referring to things in there. Mm-hmm. And please, Doctor, begin your presentation when you are ready. We are eager to listen. Thank you.
Thank you, and thank you to all the members of the committee and everyone who's here today for the invitation to speak to you. I am tremendously honored to be able to speak to you today and to represent the parents who are suffering tremendously from this type of pathology. That what I'm going to do today is I'm going to start by describing the situation that we find ourselves in, and it's pretty horrific. Then I will talk a little bit about the pathology, and I might get a little technical at that point, but it's important to understand this is not a new form of pathology that's unique in all of mental health. This is standard and established stuff. It has to do with attachment pathology and personality disorder pathology and family systems pathology. And once we return to the path of established psychological constructs and principles, we can absolutely solve this. The problem is we got off track. We got into the wilderness of new forms of pathology, and that's derailed our ability to solve this, creating a lot of high conflict divorce, clogging our court systems, and destroying families. And so I'm going to describe a little bit about the pathology, and then I'm going to move from the pathology into the solution. What do we do about this? And we can absolutely solve this once we understand what the pathology is and once we get the proper professional expertise to assess, diagnose, and treat the pathology. So again, thank you for the invitation. I have a handout that's in your booklets there. And if you could turn to the last page for a second, you'll see a picture of this little girl at a soccer field between her mommy and daddy and her stepmom and stepdad. That's a healthy, separated family structure. That's what divorce or post-divorce family is supposed to look like. And now, when you look at this, you can see how fragile that little child is between her mommy and daddy. Because if there's a lot of anger and hostility between mom and dad, guess where it's going through? It's going through her. And it destroys children when there is a good deal of hostility and anger in the family. The issue that we're facing primarily is that one of the parents in this family is a narcissistic personality or a borderline personality. There's about 5 to 6% of the population are narcissistic personalities, about 5 to 6% are borderline personalities. So that makes about 10% of the divorces will involve a narcissistic or borderline personality. They are excessively high conflict. And a lot of times people say, oh, it's both parents. No, no, no. When you got a narcissistic or borderline parent, it only takes one. And that parent creates this intense conflict that moves through the child and destroys the family. And right now, what we have in this situation is that nobody is doing anything to stop it. Professional psychology is not doing anything to stop it. The legal system is not doing anything to stop it. That children are losing a relationship with a normal range and loving parent. Parents are losing a relationship with their children, oftentimes for the rest of their lives. A normal, loving parent is losing their child, and we are leaving children with a significantly pathological, narcissistic, or borderline parent. And no one is doing anything to stop it. Now, this is not my field. High conflict divorce is not where I come from. I actually come out of ADHD and early childhood mental health. And I was clinical director of an early childhood assessment and treatment center and entered private practice about 2008. And that's when I ran into my first case of parental alienation. And back in 2008, I had never heard the word parental alienation because no sane mental health professional goes into high conflict divorce. Because high conflict divorce, it's too risky professionally. You're likely to get licensing board complaints from these angry, narcissistic, borderline parents. If you make a misstep with the legal system, that could be, you could lose your license or get in trouble with the licensing board, the legal system interface. And therapy isn't particularly helpful because you got these parents who are conflict, and so there's no rewards out of doing therapy. So mental health professionals go into other domains, ADHD, autism, trauma, eating disorder, anything. But mental health professionals do not go into high conflict divorce. And what that creates is a situation that the ones who go into high conflict divorce, the only motivation to do that is because it's very lucrative. Child custody evaluations are $20,000 to $40,000 per evaluation, and let me tell you, they are significantly problematic. Then therapy, there's some reunification therapy, they call it. There's no such thing as reunification therapy. Not in any model, not any theorist, no such thing as reunification therapy. But people say they do it, and it goes on for years. So it's a nice, lucrative way. You have your slot in your schedule filled, and it's paid private pay because insurance won't pay for it, but it's court ordered. And so you just, for 3 or 4 years, you do therapy and nothing changes. So it's a very lucrative for mental health professionals, but not very rewarding, and nothing gets solved. So when I first ran into parental alienation, this issue, back in about 2008, I started to look into this one particular family I was working with and looked at the failure of the legal system and the failure of the mental health system surrounding this, and I was appalled. Absolutely appalled by the absence of professional knowledge and the absence of professional competence. I was so appalled that I shifted my career out of ADHD in early childhood. Hopefully I'll have a chance to get back to that at some point, because this needs to stop. Families are being destroyed. These children are losing loving relationships with loving parents, and we're leaving children with the pathology of a significantly psychopathology parent, narcissistic borderline parent. So then I set about, back in about 2008 till now, to create the solution, to develop the solution within professional psychology. And that solution is to return us to standard and established professional practice. Now, on the first page of the handout, I have some discussion of Gardnerian parental alienation syndrome. And with all due respect to the chairwoman, the problem is the syndrome idea. Back in the mid-'80s, the psychiatrist Richard Gardner proposed this entirely new form of pathology, which he called parental alienation syndrome, that was unique in all of mental health, requiring this set of 8 diagnostic indicators that he just made up out of thin air. Now, there was some support for what he's seeing, but he made up, he skipped the step of diagnosis. Diagnosis is the application of standard and established constructs and principles to a set of symptoms. Instead, he proposed this new form of pathology called parental alienation. And in doing that, he led everyone off of the path of professional psychology. And immediately, establishment psychology challenged Gardner and said, look, there's no scientific evidence for a new form of pathology in mental health. And it divided professional psychology into the schism of advocates for parental alienation and detractors of parental alienation. And we will still see this division within professional psychology. There's no such thing as parental alienation. Well, yes, there is. For the most part, both sides are right. Both sides are correct. The Gardner's model of parental alienation syndrome, back in 2008 when I started to look at this and I looked at Gardner's model, it's horrible. It's really, really bad. I understand why the people who are critical of that are so critical of it. It's not a good model of pathology. And this is not a unique new form of pathology. He skipped diagnosis. At the same time, Gardner was correct. There is a pathology here. This is a narcissistic borderline parent who is twisting up the family and twisting up the child. So he was right in that respect. He just didn't do a very good job of diagnosing it. So then what I set about to do, recognizing that problem, the second problem that emerges from this is that the legal system is not designed to do family therapy. It's designed for different functions. It's designed to follow the law, not figure out where the pathology is in the family or litigate between whether the child should take soccer or music lessons. That's not the role of the court system. And so the court system needs to rely on professional psychology and the expertise in professional psychology. But the moment we wander off into new forms of pathology, we undercut the expertise that we are providing to the court system and that the court system needs. And that prevents the court system from responding appropriately to this type of psychopathology. So, recognizing that back in 2008, 2009, I set about developing the diagnosis, returning to the step that Gardner skipped. What is this pathology that we're looking at? And fundamentally, if we have a child rejecting a parent, that's an attachment-related pathology. The attachment system is the brain system for love and bonding, governs love and bonding throughout the lifespan, including grief and loss. A child rejecting a parent is an attachment pathology. So from just that place to begin with, the attachment system is a predator-driven system developed over millions of years of evolution to protect children from predators. The attachment system never spontaneously dysfunctions. It only dysfunctions in response to what we call pathogenic parenting. Parenting practices that are producing pathology in the child. So if I have an attachment pathology in a child rejecting a parent, that's as bizarre as a parent rejecting a child. Oh, I don't like, you're annoying about your homework, I'm going to put you in foster care. No, that never happens. That's really bizarre for a child to reject a parent, because there's a predator who's more than happy to eat the child. In fact, bad parents actually more strongly motivate the child, because a bad parent exposes a child to the predator, so the child is more strongly motivated to bond to the bad parent. That's called an insecure attachment. And so I have an attachment pathology in the child. I know it's being caused by one or the other parent. If it's by the rejected parent, then we're looking at child abuse. We're looking at some sort of physical abuse or sexual abuse or something really bad that that parent's doing that's causing that child to reject the parent. That parent is more damaging to the child than the predator would be. Or it's being caused by this allied and supposedly favored parent. And what that pathology is it has to do with, it's out of family systems therapy. It has to do with what's called a cross-generational coalition of the parent with the child against the other parent. And so they formed a coalition against the other parent. And so I know one or the other parent is causing this child's pathology. It's just a matter of determining which one. So let me talk a little bit about families right now and what's happening in the families. There are four basic models of psychology: psychoanalytic, cognitive behavioral, humanistic, existential, and family systems. Family systems therapy is the only one that deals with families. All the other are individual-based models. So when we're talking about families, we should be over in the family systems literature. And up on, I think, the third page there's a little diagram of a healthy transition of a family, post-divorce transition of a family. Families go through a lot of transitions over the course. First one has to do with uniting the couple into a marital unit. Now, if they divorce at that point, before there's a birth of a child, they go back to being individuals. But the moment there's a child born, that's now a family. And divorce does not end the family. The family will always be there once you have a child. Divorce ends the marriage, not the family. And what happens is we go from the intact family structure that was united by the marriage to now a post-divorce separated family structure where the parents are living apart, but that's now united by that child. It's the child holding the family together because of the shared bonds with both parents. And that's that little girl in the soccer uniform. She's holding this family together. But that puts the child in a very vulnerable position, that if there's nasty conflict stuff going through, that's going to rip the child apart. And so that's, as you move down into the third picture there, we get what's called a cutoff family structure, where the child, because there's a conflict between the parents, the child is either in the middle of the conflict and they can't stay there for too long, a year, and then boom, they choose one side or the other in this to get out of the middle of the conflict. And so you get that cutoff family conflict. Cutoff family structure is described by Murray Bowen. He's one of the top people in family systems work. The cross-generational coalition is described by Salvador Minuchin and Jay Haley. These are top-notch experts in family system stuff. This is not new forms of pathology. We know exactly what's going on. So we get this cutoff family structure here. And if you look at that third picture, that's not divorce. That's the death of a parent. A cutoff family, that mother in that third picture is essentially dead. The healthy divorce is that first picture. It's a separated family structure that's united by the child and by the shared love of the child for both parents and from both parents. Another important thing to recognize in that shared love, a lot of people will say a child has the right to love both parents, and that's absolutely true. The child has the right to love both parents. In addition, the child has the right to receive the love of both parents. That's incredibly important for child development, to get the love of both parents. There are four types of parent-child relationship: mother-son, mother-daughter, father-son, father-daughter. All of those relationships are magnificent and important, and none of them are expendable. The mother-son relationship is likely to be the most affectionate. There's a lot of affectionate bonding going on there. And the son is going to use that mother template for his wife. The mother-daughter relationship is perhaps one of the most complex, and that daughter is going to get a lot of gender-related self-esteem and self-identity from that mother-daughter relationship, and she's also going to use that as a template for raising her own children when she becomes a mother. The father-son relationship gives a lot of the male kind of self-identity and self-esteem issues that go forward for this, and helps a young man become a responsible and mature young man. The father-daughter relationship, I've got a daughter, again, one of the most affectionate ones. That's daddy's princess, and she's going to use that as a template for her husband and how to solve things, or how to choose a husband and work with a husband in her own relationship. All of those relationships are important. None of them are expendable. That third picture where we lose a parent, no, that is not healthy for the child. And we must make sure that all post-divorce families have that first picture, that all post-divorce families have that healthy separated family structure. We don't have a choice because it's in the child's best interest. We must accomplish that. The issue, as we move to the following page with John Bowlby on attachment theory, the moment we move back to understanding this as an attachment-related pathology, John Bowlby, the king kahuna of attachment back in the 60s and 70s, he first described the attachment pathology, says in that second slide, the deactivation of attachment behavior is a key feature of certain common variants of pathological mourning. It's the inability to process sadness in the family. And then the following quote links, down at the final one, that disturbances in personality create disordered mourning. We turn to the personality disorder people, and Otto Kernberg describes how the narcissistic parent is unable to process sadness and grief, and instead translates it into anger and resentment loaded with revengeful wishes. That the narcissistic and borderline personality cannot process sadness. And so when the divorce takes place, that narcissistic borderline parent, instead of processing the sadness around the divorce, turns it into anger towards the other spouse. And the narcissist is vulnerable to rejection. The borderline is vulnerable to abandonment. And so there's a slight difference in how they will express it. The narcissist, oftentimes you will find a narcissistic husband, a narcissistic male. It tends to be more prevalent in males. And it has a domestic violence feel to it. And oftentimes you will have this narcissistic husband has been kind of berating and demeaning to his wife for kind of years. Finally, she can't tolerate it anymore. She divorces him, and he says, "How dare you divorce me? How dare you have the temerity to reject my magnificence? You'll be sorry you divorced me. I'm going to take what you most love in your world, your children, and I'm going to kill them for you. I'm going to take their love and destroy their love that you have with your children. You'll be sorry you divorced me." Whoa. Whoa. And people are letting him do that. Therapists are letting him do that. The court is letting him do that. And this mom is losing her kid for the years, decades, maybe the rest of her life, because of this narcissistic desire to get revenge on her because she had the temerity of divorcing him. The borderline mom is borderline personality is often associated with sex abuse. So there's a potential that she's been sexually abused as a kid. And so when the divorce happens, and she's afraid of abandonment, she's being abandoned by her ex. So one of the ways she manages her abandonment fears is, I've got the children. You can't abandon me because I've got what you want. I've got the children. And as long as the children love me, I'm not the abandoned one. They're abandoning you. You're the one who's being abandoned, not me. I'm the wonderful parent who never is going to be abandoned. But in addition, when the children go over to spend time with their dad, her abandonment fears activate big time. She's tremendously anxious because they might develop a loving bond with him and then they're going to abandon her. So she gets really, really anxious every time the kids are separated from her. But she doesn't know where that anxiety is coming from. She just knows every time they're with their dad, I'm really anxious. Now, if she has a sex abuse trauma history in her own background, she begins to think, Dad is abusive of them. There's some sort of threat from Dad. Dad's a problem. And so she starts to develop these false beliefs that the children are somehow in danger from Dad. And so you get a lot of these allegations into CPS and things of child abuse. And CPS looks at it and says, there's no child abuse here. But she continually maintains this high anxiety state with this. So on the next page, we can look at the family systems kind of thing. Third picture down here, we have Salvador Minuchin. He just passed away recently, a week or so ago. One of the top people in family systems. 1993, he drew a diagram of what this family structure looks like. The cross-generational coalition, in this case the father and son have formed a coalition against the mother, and you can see the child is above the mother. The child is empowered by this coalition to judge the adequacy of the mother. And so it's called an inverted hierarchy. So now the child is judging the parent. That's weird. Parents judge children. Is your behavior appropriate, inappropriate, and then we deliver punishments or rewards based on our judgment of children's behavior. Here we have the whole world switched on its head. The child is judging the parent and delivering punishments to the parent as to what, because the child is being empowered by the narcissistic or borderline parent. And then the second diagram there is that can result in that cutoff family structure, where the mother is now cut off from the kids. The way this is accomplished, final quote there about psychological control. Psychological control is an established psychological construct in professional psychology. That Barber quote down at the very bottom, I want you to note who published that book, the American Psychological Association. Then, so we know there's psychological control of the children and how it occurs. The way the narcissistic borderline parent gets the child to reject the other parent isn't by bad-mouthing the other parent. A lot of people think it's by criticizing. No, that's not how it happens. How it happens is get the child to believe that they're being victimized by the other parent. So let's say the child goes off and spends a visitation period with their mom, comes back to the narcissistic dad, and the dad starts questioning the child. How are things at your mom's house? Fine, everything was good. Really, you guys didn't get into a fight? No fight. Really, no arguments about anything? Now, if the child doesn't criticize the other parent, then the narcissistic dad's going to stay on it, and if she doesn't do it, he's going to get cold, he's going to get rejecting, he's going to communicate to the child, you didn't do the right thing. You didn't give me a criticism of the other parent. The moment the child realizes that, the child knows what the dad's wanting. They're wanting a criticism of mom. Well, it was kind of boring over at mom's house. That's all it takes, is just a little criticism. The dad is then going to inflame that and say, oh my God, I can't believe she doesn't have things planned for you. She's so selfish, she only thinks of herself. She never considers what anybody else wants. Now, it looks to the child and to all the world as if it's the child criticizing the parent and that parent's just being supportive of the child. No, it's incredibly manipulative. Narcissistics and borderline personalities are the best at manipulation. You get the criticism out of the child, then you come in and support it, and you look like the nurturing parent, and the criticism's coming from the child, and all the nasty stuff that you're doing is hidden underneath the child. Notice what I said in that. Oh my gosh, she's so self-centered. She never considers what anybody else. He's criticizing the other mom. He's giving the child a framework for denigrating the mother. But it doesn't look like it, because it's the child who said it was born. And he's just being understanding. And you do that for a couple months, year. That child knows the story. That child knows the routine. They come back from a visit with mom's house. Dad says, how are things at mom? Oh, she was so selfish. She didn't listen to me. She didn't... Gives the dad what he wants, and then the dad starts to go. And so the way that the father, or the way that the mother, the borderline mother, creates the rejection of the other parent is by getting the child to believe they're being victimized by normal range parenting. Now, I want to explain a little bit where that comes from. And that's that next page on the handout with the blue diagrams down here. Now that's Aaron Beck at the top. Aaron Beck, again, is one of the top people in professional psychology. And he talks about schemas in our attachment networks. Our attachment system forms patterns of relationships, expectations. What do I expect from myself and from the other in relationship? And then we use these patterns, these schemas, to guide our interpersonal relationships throughout our lifespan. What happens for the narcissistic or borderline parent is they had childhood trauma of their own. That's what created their narcissistic and borderline parent, is that they came out of child trauma, psychological or physical, potentially sexual abuse of them as a child that created their narcissistic and borderline personality pathology. And in their attachment networks are these patterns. John Bowlby calls them internal working models. Beck calls them schema. Freud called it the transference. We know that what this was happening. We have these patterns in the brain. Now, when the divorce takes place, those patterns reactivate again. And the pattern in the narcissistic brain is very specific. It's abusive parent, victimized child, protective parent. We have that schema pattern, that trauma pattern in the internal working models of the narcissistic borderline parent. Abusive parent, victimized child, protective parent. In addition, the brain is also activating 3 networks for the current child, the other parent, and me as a parent. And it's the activation of 2 sets of brain networks, one from the past, abusive parent, victimized child, protective parent, one from the current situation, the other parent, the child, and me. And when we activate those 2 sets of brain networks at the same time, they become fused, they become equivalent. So we actually have this parent believing that the other parent is an abusive parent, this child is being victimized, and I'm the protective parent. It's called a trauma reenactment. They are reenacting their own childhood trauma in the current situation. The issue is, none of that narrative is true. The child is not being victimized, the other parent isn't abusive, and you're not a protective parent. It's all a false drama, it's all a false narrative, a kabuki theater that is created, and the moment they get the child to believe they're being victimized, that automatically defines the other parent as abusive. You can't have a victimized child unless you have an abusive parent. I don't care what that parent has done or what the parenting, they've automatically been defined as the abusive parent, and then it allows the narcissistic parent or borderline parent to come in and be the protective parent. I'm protecting the child from the abusive parent, and the child says, yes, I'm being abused. The child comes into my office and says, my dad abuses me. I say, well, what's he do? He says, he took my iPhone away. Well, that's not abuse. Why did he take your iPhone away? Well, because I was mouthing off and wouldn't do what he said. That's called discipline. That's not called abuse. But you can hear that, how it forms when the child goes back to their mom and says, Dad took my iPhone away. Oh, I can't believe that. He's so insensitive to you. And she creates this false belief in the child that the child's being victimized. And so the child runs out to the therapists and lawyers and the judge and says, yes, I'm being abused. If you don't explore that to the next level, what do you mean being abused? Took my iPhone away. If you just buy the abuse, oh, yeah, okay. Dad's being a problem. Dad's too insensitive to the child's feelings or whatever. And people start to believe the false narrative that's being created. Now, is there authentic child abuse? Absolutely. I worked in the foster care system. When I was working early childhood, I worked with kids in the foster care system. Electrical cords, sexual abuse. There's absolutely child abuse out there. The way I explain it is, dogs exist. Child abuse exists. Cats exist. The narcissistic borderline personality pathology of a parent exists. The existence of dogs does not nullify the existence of cats, nor does the existence of cats nullify the existence of dogs. Both of them exist. Now the issue is, both dogs and cats have fur, 4 legs, and a tail. So how do we tell them apart? Well, cats have retractable claws. Dogs don't. Cats go meow. Dogs bark. And we can actually look at their DNA and tell them apart. So if you know where to look, you can tell them apart. And that becomes the important thing for the solution, is to understand where this pathology comes from and what it is. Cross-generational coalition, you'll see the inverted hierarchy. Trauma reenactment, you'll see the belief, the false belief in the child that they're being victimized when they're not. The attachment-related pathology in a child that is extraordinarily unusual, extraordinarily rare. If you know where to look, you can identify the difference between a dog and a cat. But right now, we don't have the professional expertise out there to do that. This type of pathology involves the attachment system, personality disorder pathology, family systems pathology, and complex trauma. We need expertise in those 4 domains from our mental health professionals, and right now we don't have it. There's not a mental health professional working with this type of pathology who has the necessary level of expertise. Essentially, what I describe to people is we currently have plumbers and electricians doing open heart surgery, and all the patients are dying. And they may be wonderful plumbers, they may be wonderful electricians, but they are not cardiac surgeons. We need the top level of expertise out there to deal with this very complicated, very severe form of attachment-related family pathology. In mental health's interface with the court system, I don't blame the court system. A lot of people say, oh, it's a problem in the court system. This is not the court system's problem to diagnose psychopathology. That's us, that's psychology. If we don't come with the professional expertise necessary for the court system to act, then the court system doesn't get the proper guidance and they don't know what to do on this. So that frames up the core of the solution. Skipping a couple pages here into the diagnostic indicators up here. So my book, Foundations. What I did in Foundations, and the reason it's called Foundations, is I wrote and described what this pathology is in great detail and comprehensively, using only standard and established constructs and principles. Every time I refer to the word parental alienation, I always put it in quotes, because I don't, as a clinical psychologist, parental alienation doesn't exist. Personality pathology exists, attachment pathology exists, complex trauma exists, cross-generational coalition. I know what all of that stuff is. Parental alienation is a popular culture term that and I don't care, everybody else can use that phrase to kind of capture the complex nature of the pathology, the legal system, and people in the general population. For us as clinical psychologists, though, we need to stop using that word and go back to standard and established stuff. And so in the Foundations, I lay out what the pathology is, describe it in detail, leading to a set of 3 diagnostic indicators, those retractable claws, that will always show up with this particular type of pathology, cross-generational coalition with a narcissistic borderline parent, and will show up in no other pathology. No other pathology in all of mental health will produce this set of 3 symptoms. The first one is attachment system suppression toward a normal range parent. The child is rejecting a normal range parent. It's really weird. Now we're in attachment pathology, and that says there's pathogenic parenting somewhere. Second symptom is a set of 5 narcissistic personality traits in the child's symptom display. The child is showing 5 specific narcissistic symptoms: grandiose judging of the parent, a sense of entitlement, the parent's supposed to meet my needs, an absence of empathy for the parent, haughty and arrogant attitude towards the parent, and a splitting, a demonization of the parent. I call these the psychological fingerprints of control on the child by a narcissistic parent. We cannot control a child without leaving fingerprints of that control. And so that second symptom are the fingerprints. How does a child acquire narcissistic personality traits? Is that child narcissistic? No. it's because the parent is narcissistic, influencing the child, and it's the child is picking up the attitudes of this parent towards the other parent, the absence of empathy towards the other spouse, the haughty and arrogant attitude towards the other spouse. So that's the second symptom. Third symptom is that victimization symptom, that trauma reenactment, false one. That the child has a fixed and false belief that they are being victimized by the normal range parenting of the targeted parent. That it's abusive. I'm being victimized because my dad took my iPhone away. And it's a fixed and false belief. In psychology, a fixed and false belief is a delusion. And the belief that you are being victimized is a persecutory delusion. That it affects only one area of the child's life is called an encapsulated persecutory delusion. The child is showing an encapsulated persecutory delusion. Where is that child getting that from? The narcissistic borderline parent who believes this false narrative of victimized child. And so the child is acquiring this encapsulated persecutory delusion from the other parent. So we are essentially lifting the fingerprints of the pathogenic parenting from off of the child's symptom display. No other pathology, even authentic child abuse, will not show this set of symptoms. Child doesn't have a haughty and arrogant attitude towards their abuser. They don't have a sense of entitlement towards their abuser. No, authentic child abuse doesn't show these sets of symptoms. So we have three symptoms. We'll always define it. When you have a child who is this pathogenic parenting, pathopathology, genesis creation. So a parent who is creating pathology in the child, they are creating developmental pathology, suppression of normal range attachment, bonding motivations where the child's losing a parent. Narcissistic personality traits, they are creating a personality disorder in their child, and a psychiatric delusion in the child. When you have a parent creating that level of pathology in the child, the DSM-5 diagnosis for that is V995.51 child psychological abuse. And so right now in my practice, if I get this, that's the diagnosis, child psychological abuse. That's what I'm advocating that all mental health professionals start to use, child psychological abuse, and to assess along these lines. I have little booklets that describe the assessment process and how you assess for retractable clause and whether it goes meow or bark. It's essentially about a 6-session assessment. One session each with each of the parents. You begin to develop the symptoms. A session with the targeted parent and the child where you get to see it displayed before you. And then a session with each of the parents again to check their schemas and their patterns based on all of that. In about 6 sessions you can say, 8 if it's really complicated, you can tell whether or not it's a cat or a dog. Because it's very focused. I'm just looking at, is this pathogenic parenting by a narcissistic borderline parent? So I try to keep these other booklets brief so that they don't have so that they're accessible. Foundations is the one that describes all the information. In order to solve this pathology, though, we need the professional expertise in the attachment system, complex trauma, family systems, and personality disorder pathology that we currently don't have out there. Now, when I go back to California this weekend, starting Saturday, Sunday, and Monday, I'm doing certification seminars. So I have about 10 people right now that I'm going to be training in this across 2 days and certifying them and saying you have the professional knowledge in not only the foundations of what the pathology is, but also in the ability to do the assessment. And there's also another intervention called a contingent visitation schedule where we can maybe get a handle on this by when the child becomes more symptomatic, we reduce the time with the narcissistic borderline parent. When the child's symptoms go away, then we go back to 50-50 custody. So we're monitoring the child's symptoms, and if this parent starts to create symptoms, we're going to reduce the time with this parent, increase the time with the other parent to fix everything, and then it goes back to, and so it's a data-driven decision-making off of this. And this is what I would recommend a lot of the court systems begin to start to use when this is diagnosed. So I'm going to be training up some ABPA, attachment-based parental alienation certified mental health professionals. But that's a slow process. That's not going to give the court systems the necessary level of professional competence generally. So I'm working with a nonprofit down in Houston, Children for Tomorrow, Dwayne Lindsay, on developing or implementing a pilot program for the family courts in which I will come into Houston and a 2-day seminar, train up the mental health professionals. And the seminar is, in the morning is the foundations of the pathology, afternoon is the diagnosis, second day is assessment, afternoon is treatment. And so it's boom, 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 and get the necessary level of professional expertise to be able to use a standardized and structured assessment protocol to document the child's symptoms. And we look at the targeted parent using parenting practices rating scale, look at their parenting, look at this parenting, come up with a diagnosis, and give a brief 6 to 10 page report to the court saying, this is what we're looking at, this is what needs to happen. And you can do that in 6 to 8 weeks with the assessment, and so it's a relatively quick process for the court system. Then if, let's see, and so I'll describe it on this point in your handout. So when the court runs into any case of attachment-related pathology surrounding divorce, I'm not using the word parental alienation. When the court runs into attachment-related pathology surrounding divorce, they're going to refer the child or the family to an ABPA-certified person who's going to do a structured and standard assessment and decide and come back to the court and saying, yeah, we're looking at ABPA, we're looking at this narcissistic borderline pathology here. If that's the case, then the court is going to take a new ABPA-certified therapist and team them with an amicus attorney. And the amicus attorney, that's my 3rd day of seminar for the pilot program, is I'm going to train up the amicus attorneys on what the pathology is and how to work with the therapist. So now we have the legal and mental health expertise necessary to solve the pathology. And the court's going to team up that team and insert them into the family, and they're going to stay there for probably 5 or 6 years to stabilize the level of pathology in this family, to make sure that little girl has both parents and the love of both parents. We don't have a choice. We're going to fix this family. We're going to make sure this family makes a successful transition to a healthy family structure. The legal system, because of its adversarial nature, fosters conflict. And so everybody's running to their attorney and going into conflict. By putting an amicus attorney in the middle, we remove the conflict. The amicus attorney is working with the therapist. Now, they can, the mom wants the child to take dance lessons, dad wants the child in soccer. Take it to your therapist. Don't litigate it. Therapist listens to everything and can help the family through conflict resolution, communication. And the therapist ultimately listens to everybody and says, you know what, we're going to go with the dance lessons. And we're going to do dance lessons for a couple years, and then we're going to do the soccer lessons. You guys can't come together on that. Now, if one of the parents wants to take it to litigation, they can. They can take it to litigation and go before a judge. The judge is going to listen to your attorney, and the amicus attorney. Amicus attorney is going to talk to the therapist. Amicus attorney is going to explain what's going on. The judge is hopefully going to support the therapist and thereby empower the therapist to solve stuff. Don't bring it into the legal system. Don't bring it into the court system. Figure it out with your therapist. Work it out. This is a family therapy issue. This is not a legal issue. This is not a child custody issue. And in that process, we can provide the court with the necessary level of professional expertise needed to solve this, and the therapist can take charge of the family's resolution into a healthy, separated family structure. So, let's see here. In closing, I just want to look at the final page there. That in that picture from a documentary called Erasing Families, All of those parent-child relationships are vital to children's healthy development. None of them are expendable. We need to make sure that children have a healthy post-divorce separated family structure in all cases. And that little girl there, I absolutely know what's in the best interest of that child. That is in the best interest of the child. I don't need a $20,000 to $40,000 custody evaluation to tell me that's in the best interest of this child. And so for me and my work, that's what I'm doing. I'm trying to get us back onto standard and established constructs and principles. And once we do, we can absolutely solve this pathology. So again, I want to thank the committee for giving me this opportunity to share my expertise and share my knowledge.
Doctor, thank you. And we just have a couple minutes for questions. Questions? I knew Representative Brown, Lowry Brown, you had a question?
Yes, thank you, Madam. Dr. Childress, get out my house, okay? Get out my house. But no, seriously, I want to say thank you so much because your work is invaluable. I don't think coming into this room this morning, I thought my thought pattern is where it is right now. So I just want to say thank you for enlightening me, helping me to understand what I see in my community far too often, what I've seen in my own life manifest. And for me, it's all about the children. And this is terrible for the children.
Absolutely.
And for the victimized parent on the other side as well. But the children in particular become adults who are stuck with these patterns that you're talking about, that are stuck with these new ways of acting out, and then become a parent.
And can I say something?
Yes, how do they get out of that cycle?
One of the important things to teach children is that we have problems with other people. But when we have problems with other people, we don't discard them. We fix them. And so if the child has a problem with a parent, we fix that. Because when you have a problem with your spouse, what do? You fix it. And so it's an important lesson, it's an important skill set for children to have, how to fix relationships when they go bad.
Right. So, and I appreciate that. The other thing I wanted to just point out is that how, in situations where there's domestic violence, I believe that they're more primed to have a narcissistic parent, and that how do we, as a society, not see that starting to become the next step to the separation and divorce, and how do we protect that family?
We're looking at child abuse, either physical abuse, violence abuse, domestic violence, that, or psychological abuse, but it's coming from a narcissistic parent, one side or the other. So I know I have a narcissistic parent somewhere, and that's the issue that mental health professionals need to step up and recognize. And one of the central features, I forgot to mention this, but about not only the pilot program, but the child abuse reporting laws. I noticed in the Pennsylvania legislature, child abuse reporting laws refer to mental abuse, but don't define it. And that would be my recommendation, it's in the handout there, is a minor adjustment to the definition of child abuse that would be warranted by the DSM diagnosis of child psychological abuse, where we simply define child psychological abuse as creating pathology in the child. The Pennsylvania law talks about medical problems. They don't talk about inducing psychological disorders in the child through pathogenic parenting. And as diagnosed by a mental health professional, I would probably add that phrase just so keep it in a professional level. But revisiting that child abuse reporting laws would send a clear message to all mental health professionals that they need to up their game, that they need to be looking for this child psychological abuse in addition to just physical abuse and things. Domestic violence is a narcissistic parent. Physical abuse, narcissistic parent. Sexual abuse, narcissistic parent. This type of pathology, narcissistic parent. It's all the same.
So, as a lawmaker, how do we, if we already know that in a situation where there's domestic violence, that most likely there is a narcissistic, or probably about 90 to 99% there is, right? So if that family going into the court system should be flagged immediately.
You will, the moment you got attachment pathology, so if you have a child who doesn't want to be with a parent because that parent's violent and a domestic violence issue and that child's hesitant to be with that parent, this mental health professional is going to look at that. They're not going to see a child having haughty and arrogant attitude towards that parent. They're not going to see the signs of the attachment-based parental alienation. Instead, they're going to use a parenting practices rating scale and say, oh, wow, you're a violent, aggressive parent. And this is a problem we have over here. And so you're going to come out with a different treatment recommendation out of this for the domestic violence as the other. And so that's the critical issue, is you get a competent, capable expertise that knows domestic violence and knows the difference between the two.
So, Dr. Childress, who do you suggest would pay for that? Because I experienced that in my own life, right? So I went into the court system as an abused parent, and the court system never really gave value to the abuse and didn't really want to look at it and kept treating us as if we were having an argument and just in a little bit of conflict. And therefore, that never was really dealt with when it came to custody, child support. They said, we don't want to deal with that. That's a separate issue, separate court. Take your PFA over there. But in a custody hearing, we're going to just deal with this as if you're just having an argument, which the child, my child, I'm just going to use myself as an example. That's why I became a lawmaker. So the child paid the price. Mm-hmm. So how do we, as lawmakers, keep that from happening from other parents that are in domestic violence situations? The
mental health report to the court needs to be clear as to what the child protection needs are. And so it's not, I would say it's an inappropriate burden to put into the court system to determine psychopathology in the family. So you get the mental health assessment of the child and of the family. So one of the issues about domestic violence, let's say, and I consider this version with the narcissistic parent, I'm going to kill your child, to be a version of domestic violence. And so this is in the scope of that in many ways, using the child as a weapon rather than hitting the mother. At the same time, with the borderline moms, you can get where the mom and dad are having an argument. Let's say dad's in the bedroom, mom's in the hallway. Dad's like fed up and he's just so frustrated with this mom just saying he's crazy, and he says, I'm out of here, and he pushes past her, and he kind of pushes her out of the way so he can go down the hallway and get out of the house. The borderline mom says, oh yeah, there's been domestic violence in my house. I say, what? And she describes that to me. And I say, he pushed you, did he ever hit you? Did he ever? No. Did any other case? No. Did any other case? No. And so it's a dog and a cat thing. Mm-hmm. And this is something, do we really want that in a trial for, $10,000, $20,000, $40,000 trying to prove this in the trial? We need to bring it into the mental health office with expertise, and that's the critical issue. Right now we have electricians and plumbers. We need the top-notch people working with our court system who know domestic violence, who know child abuse, know what it looks like, know complex trauma, and also know borderline, and can determine whether this is a cat or a dog. And then tell the court, we got a dog here, we got domestic violence, this kid needs to be protected, I'm worried about this is what needs to happen in terms of the child's treatment needs, not custody. Right. The child will still love that dad. The child will still benefit from a relationship with that dad. I just don't want to put the kid at risk. Right. So I got to make sure that dad's safe.
I see there's other folks that have questions, so I'm going to wrap it up with this. I'm also
Representative, because I've got 4 more people and I'm way over.
Okay. All right. Could I finish or I'm done?
Just finish up, please.
I'm also on the health committee, and what comes to mind to me is health care reimbursement for the mental health piece. Have you had any experience with that? And I conclude there. Thank you, Madam Chair.
They're not going, the insurance companies won't pay for this. No, because the V code, child abuse is a V code. It's not a main code. Would I like it? Yeah. But this is a whole lot less expensive than a $40,000 child custody vow.
Okay, thank you very much.